with you that poverty is an important issue. I also agree that we need to understand what causes poverty and what causes prosperity, or we won't be able to fix the problem. Kwashiorkor is a condition in which the abdomen swells because fluid leaks from the vascular space. Kwashiorkor is a phenomenon associated with starvation and lack of protein. We've all seen the sad and horrific pictures and famines in Africa. Kwashiorkor is no longer present in the United States. Capitalism in our country vanquished starvation, along with smallpox and polio. Anyone who wishes to equate poverty with death must go to the third world to do so. Anyone wishing to equate poverty with death must seek out socialism and tyranny. Those who wish to see death from poverty in our country are blind to the truth. While we all hope to lessen the sting of poverty, we need to put poverty in America into context. Robert Rector of the Heritage Foundation recently put together a profile of the typical poor household in America. The average poor household has a car, air conditioning, 2 color televisions, cable or satellite TV, a DVD player, and an Xbox. Their home is in good repair and is bigger than the average non-poor European. The average poor person reports that in the past year that they were not hungry, they were able to obtain medical care, and had sufficient funds during the past year to meet all essential needs. This is the average poor person in America. An American citizen can expect to live a decade longer than the world average, and nearly twice as long as some African countries. Infectious diseases such as AIDS decimate third world countries, while American citizens are often immunized from disease or easily treated for these conditions. While more than 750,000 people around the world die each year from malaria, the United States has 0 deaths from malaria. At the turn of the last century, life expectancy in the U.S. was about 46 years of age. Life expectancy now approaches 80. By all measures, this is a great success. Mortality due to infectious diseases affects 50% of children in Africa and is now less than 1% in America, an extraordinary success. One of our witnesses today, Michael Cannon, will explain how over time, poor Americans became healthier than wealthy Americans of a previous generation. Only in America would we label it as a death sentence for the children of poor families to have a reasonable expectation of growing up healthier than the adults of wealthy families did in the immediately preceding generation. To the extent that poverty is a social determinant of health, much of it can be attributed to behavioral factors. Over 30% of those living below the poverty line smoke, compared to 19% of the rest of the population. Consider that it costs between $1,500 and $2,000 per year to smoke a pack of cigarettes a day. This is nearly 20% of an individual's income at the poverty line. Obesity rates among the poor are higher than the general population. We're not talking about Kwashiorkor in our country, we're talking about obesity, an unimaginable problem for those starving in North Korea or Somalia. An interesting example of culture's influence on health is known as the Hispanic health paradox. According to a National Institute of Health study, despite higher poverty rates, less education, and worse access to health care, health outcomes among many Hispanics living in the United States today are equal to or better than those of non-Hispanic whites. Researchers do not argue that the Hispanic health paradox has anything to do with genetics. In fact, most researchers believe the differences in smoking habits and a strong family support structure explain much of the so-called Hispanic health paradox. This context, while important, does not negate the fact that there are truly needy Americans. We all want to halt poverty. We all want to help those in need. I am suggesting today, though, that with a national debt of $14.3 trillion, we must be more precise in how we talk about poverty in America and whom we should target with scarce federal resources. We need to ask, are we targeting federal programs to those most in need? Are federal programs accomplishing their goals? Are we doing what's needed and are we doing it appropriately? Are some programs creating unnecessary and unhealthy dependence on government? We have limited resources. We have to ask these questions. We also need to understand that poverty is not a state of permanence. When you look at people in the bottom fifth of the economic ladder, those at the bottom, only 5% are there after 16 years. People move up. People do. The American dream does exist. In a University of Michigan study of 50,000 families, 75% of those in the bottom fifth make their way up to the top 20 to top 40% on the socioeconomic ladder. The rich are getting richer, but the poor are getting richer even faster. U.S. Treasury statistics show that 86% of those in the bottom 20% of the economic ladder move to a higher level. We need to be proud of the American dream and promote policies that encourage the economic growth that allows so many to rise up out of poverty. In the half of the century since LBJ's war on poverty began, we have spent $16 trillion to fight poverty. We now spend over $900 billion a year and have over 70 means-tested welfare programs under 13 government agencies. Yet thanks or no thanks to the federal government, we now have more poverty, as measured by the government, than we did in the 1970s. An all-time high, 40 million Americans depend on food stamps, and 64 million are enrolled in Medicaid. If poverty is a death sentence, it is a big government that has acted as the judge and jury, conscripting poor Americans to a lifetime of dependency on a broken and ineffective federal government. One of the fastest growing poverty programs is food stamps. The cost of the food stamp program has doubled just since 2007. There is evidence that the program actually leads to higher rates of obesity. An Ohio State University researcher has calculated that controlling for socioeconomic status, all things being equal, women who receive food stamps were more likely to be overweight than non-recipients. When we've tried to place restrictions, say you can't buy junk food, the federal government has said, no, we can't place restrictions on food stamps. A recent article pointed out that 30% of the inmates in Polk County, Iowa, were receiving food stamps illegally. In Wisconsin, fraud is so rampant, prosecutors have given up going after the common cause of abuse, such as selling food stamp cards online. There's so much of it, they can't even keep up with it. Leroy Fick won $2 million. I'm pretty close to finishing up. We have just another minute or two, please. Won $2 million in the lottery, and yet he still gets food stamps because there is no limit to food stamps based on assets. In America, capitalism has been so successful alleviating poverty that our doctors travel around the world. Doctors today that are here, such as Dr. Tim Halsey, not only help indigent patients in this country, but travel to many times to Guatemala to repair children with cleft palate. As a physician, both Dr. Halsey and I have treated children from Central America. We have treated children from around the world. Not only are we doing such a good job treating poverty in our country, we're able to send our efforts around the world to help thousands of cataract patients, thousands of those with cleft palate. So what I would say here today is that not only is poverty not a death sentence in our country, capitalism has done such wonderful things to lift people out of poverty that we are now helping the world, that really there are still true pockets of poverty around the world. So I think rather than bemoan or belabor something that really, truly is something that is overwhelmingly being treated in our country, we should maybe give more credit to the American system, the American dream, and give credit to what capitalism has done to draw us up out of poverty in this country. Thank you very much.
Thank you very much. We have a wonderful and distinguished panel.